How prevalent dislocated shoulders are in today's society? Well, it's more common than you might think. A dislocated shoulder is a condition where the upper arm bone pops out of the cup-shaped socket, part of the shoulder blade. This can occur from a sudden injury or from overuse and strain. It's a painful predicament that can severely limit your ability to move your arm. In America alone, shoulder dislocations account for nearly half of all major joint dislocations. It's especially frequent among athletes and the elderly, but anyone can experience it. Whether you're lifting heavy weights at the gym or simply reaching for an item on a high shelf, these everyday activities can lead to a dislocated shoulder if not done properly. So, it's crucial to understand this condition, its causes, and its effects. Now that we've gained a basic understanding of dislocated shoulders, let's explore the different types. Dislocated shoulders aren't all the same. There are actually several types. The most common type is the anterior dislocation. This happens when the shoulder slips forward out of its socket. You might hear it referred to as a forward dislocation. It's often caused by a strong blow to the shoulder or an unexpected fall. Next, we have the posterior dislocation. This is when the shoulder moves backward out of the socket. It's less common, usually resulting from seizures or electric shocks. Finally, there's the inferior dislocation, also known as a downward dislocation. This is the rarest type, where the shoulder drops down and out of the socket. It can occur due to a high-impact injury, like a fall from a significant height. Each of these types presents with different symptoms and requires a different approach for treatment. These types differ in their symptoms, so let's take a closer look at them next. Different types of shoulder dislocations come with different symptoms. In the case of an anterior dislocation, the most common type, you might notice an abnormal square shape to your shoulder, coupled with intense pain. It may also be difficult to move your arm. Posterior dislocations, though less common, are no less severe. You may experience sudden and sharp pain in the back of the shoulder, and your arm may seem to be stuck, unable to reach across your body. Inferior dislocations, also known as luxatio erecta because the arm appears to be permanently held upwards, present with a unique set of symptoms. The arm is usually fixed upward, and any attempts to move it can cause extreme pain. In each type, swelling, numbness, bruising, and weakness may also be present, indicating damage to the nerves and blood vessels around the shoulder joint. Understanding the causes of these symptoms will help us in preventing shoulder dislocations. What triggers a shoulder dislocation? This query brings us to the root of the issue. Shoulder dislocations are typically the result of physical activities or accidents. They occur when the arm is forcefully pushed or pulled, causing the ball of the upper arm bone to pop out of the shoulder socket. Sports, particularly those that involve a lot of arm movements like basketball, baseball, or swimming, are often the culprits. A wrong throw, an aggressive dunk, or an overzealous swim stroke can all lead to a dislocated shoulder. Accidents, too, play a significant role. A hard fall, a car crash, or any sudden impact can jolt the shoulder out of its socket. Even seemingly harmless activities like a vigorous tug-of-war can cause dislocation. There are certain risk factors that increase the likelihood of dislocating a shoulder. Firstly, age plays a significant role. Young adults, especially those in their late teens and early 20s, are more prone to shoulder dislocations due to their active lifestyles. On the other hand, older individuals can also be susceptible due to the weakening of muscles and ligaments over time. Certain occupations that involve repetitive overhead movements or heavy lifting can put individuals at a higher risk. Think construction workers, painters, or weightlifters. Lastly, participation in high-impact sports such as football, basketball, or wrestling can also increase the risk. These activities often involve physical contact and sudden movements, which can easily lead to a shoulder dislocation. It's crucial to remember, though, that while these factors can increase the risk, they don't guarantee a shoulder dislocation. Knowing them, however, can help in taking preventative measures. Unfortunately, dislocated shoulders can lead to complications. A dislocated shoulder left untreated can result in complications. It's a harsh reality, but one we need to address. Let's start with nerve damage. When the shoulder pops out of its socket, it can press against the nerves around the area. This pressure can cause numbness, weakness, or even paralysis in the affected arm. Next, we have blood vessel damage. Similar to nerve damage, the dislocated shoulder can compress the blood vessels, leading to a lack of proper blood flow. This can result in tissue death if not addressed promptly. Finally, there's the risk of recurrent dislocations. Once a shoulder has been dislocated, it's more prone to future dislocations. This can lead to chronic instability and pain, affecting your ability to perform daily tasks. While these complications sound scary, remember that they are preventable. Early diagnosis is key to preventing these complications. So, if you suspect a dislocated shoulder, seek medical attention immediately. How can medical professionals tell if a shoulder is dislocated? Well, the diagnostic process is a blend of art and science, involving a thorough physical examination and often imaging tests. Once a dislocated shoulder is suspected, the doctor will start by asking about the patient's medical history and the circumstances leading to the injury. They'll then conduct a physical examination, looking for signs such as a visibly out-of-place shoulder, swelling or bruising, and inability to move the joint. However, the gold standard for diagnosing a dislocated shoulder is undoubtedly imaging tests. These can include X-rays, which can clearly show the dislocation and any potential fractures. In some cases, a CT scan or MRI might be used to provide a more detailed view of the shoulder, especially when damage to soft tissues is suspected. Diagnosis is a vital step towards recovery, as it informs the subsequent treatment plan. Once diagnosed, a treatment plan can be put into place. So, a shoulder is dislocated. What's next? The management and treatment of dislocated shoulders often depend on the severity and frequency of the dislocation. Two common treatments include reduction and surgery. Reduction is often the first course of action. This procedure entails a healthcare provider manually moving the shoulder back into its correct position. While it may sound daunting, don't worry. Pain medications and muscle relaxants are typically administered to minimize discomfort during the process. However, if the shoulder has been dislocated multiple times, causing significant damage to the surrounding tissues, surgery may be necessary. The goal of surgical intervention is to repair the damaged structures that are unable to hold the shoulder joint in place. This could involve repairing torn ligaments or tendons, or in some cases grafting new tissue to reinforce the shoulder joint. Now, it's worth mentioning that recovery doesn't end once the shoulder is back in its socket, or even post-surgery. Physiotherapy plays a crucial role in the journey to full recovery. A physiotherapist will provide a personalized exercise program designed to strengthen the shoulder muscles and improve flexibility. This is important, not only for recovery, but also for preventing future dislocations. Additionally, it's essential to rest the shoulder and avoid activities that could cause further injury. Your healthcare provider may recommend wearing a sling or shoulder immobilizer for a few weeks to keep the shoulder from moving while it heals. Pain management is also crucial during recovery. Over-the-counter pain relievers such as ibuprofen are commonly used. However, in more severe cases, your healthcare provider may prescribe stronger pain medications. In conclusion, the treatment of dislocated shoulders is a multi-step process that involves reduction or surgery, followed by physiotherapy and rest. With a comprehensive approach to treatment and management, recovery from a dislocated shoulder is possible. Remember, every shoulder dislocation is unique, so always consult with a healthcare provider to determine the best course of action for your specific situation. With proper treatment and management, recovery from a dislocated shoulder is possible. Prevention is better than cure, as they say. When it comes to dislocated shoulders, this adage rings especially true. Being proactive about shoulder health can make a world of difference. So let's delve into some home remedies and exercises that can help strengthen your shoulders. First off, dietary adjustments can be beneficial. Incorporating foods rich in calcium and vitamin D, like dairy products, fish, and leafy greens, can help strengthen your bones and muscles. Now, let's flex those muscles a bit. Regular exercises like shoulder rotations, resistance band stretches, and light weightlifting can help strengthen your shoulder muscles, reducing the risk of dislocation. But remember, it's always important to maintain proper form and not to overexert yourself. Lastly, maintaining good posture is key. It's easy to overlook, but slouching can weaken your shoulder muscles over time. So, stand tall and keep those shoulders back. Remember, a healthy shoulder is a happy shoulder.